I was diagnosed with juvenile rheumatoid arthritis as a teenager. The treatment that I was given was weekly injections, and most of the time when you're diagnosed with this, your parents give it to you. But in my situation, I had to give them to myself because I was older. And it was a really scary process, and it's something that I've been dealing with now for, close to 10 years. And then in a design class, when we were trying to fix problems for people in their everyday lives or improve the design of something, we were sitting together, me, Emily, and Marissa, in our house, and we're like, what can we do? Like, what? And then I had to take my shot, and light bulbs went on there. There are 3 million people in the US with autoimmune disease that requires these types of subcutaneous injections, and a lot of them are children as well. And so when we were asking the patients, what are your problems? And a lot of them are, fear, the technique that's involved, because you have to do it at the right angle so it gets into the right layer of tissue. If it doesn't, the medicine may not be absorbed properly. So you're throwing like $2,000 worth of your injection down the drain, So that was a big problem. From the physician standpoint, it's improving their health outcomes, because if their patients aren't taking their injections correctly, that's going to not make them any better. This is our most recent version right now, and it's probably like
12.0.
12.0, version 12.0.
We were like taking a drill and like literally drilling in the lab at Westlake.
I don't know who trusted us
pathetic.
with the drill.
As you can see on the prototype, those are the bumps, the protrusions on the bottom. So from the gate theory of pain, if you saturate those nerves, the patient's less likely to feel anything, which we have the most recent time Michaela took her shot, she literally was like, oh my gosh, I didn't feel this go in. And we were like, are you serious? And she's like, yeah. And so that's when we realized it's, these 10-year-olds are seeing the needle, they might perceive more pain than there actually is.
Yeah. It's actually funny. She knows my injection schedule better than I do now, because she's always like, oh, it's time to videotape another one of your injections to see if our prototype works. So if I were a patient or a parent giving a shot to a patient, many of them are pretty young, so this is like a lot of times the case, I would just be able to get the appropriate injection site for subcutaneous. That's usually arms or thighs. I would be able to easily squeeze this for her. I could put the needle in like this, and it locks then in the right 45-degree angle, so that we know that the needle is going to go down into the right layer of tissue.
What I learned from Esteem is there's always room to learn from other people, and no solution is done in one shot. No pun intended. You have to go out and keep refining and pivoting and making sure that you're open and learning along the way, and also just to be, put yourself out there and don't be afraid to take a risk. My name is Emily Russo.
My name is Michaela Sogstad.
And this is how I fix things that matter.